Well,
Love it.
it's just past 1 o'clock Central, 2 o'clock Eastern, and I'm going to go ahead and kick this session off. Seeing the participant number rise as we get started, I'm just going to do a little bit of housekeeping before we go and give a few people a chance to settle in. As we always do at the GPN with our webinars, we have our attendees in listen-only mode. This is our way of minimizing background noise and distraction and making sure that everyone has the best possible audio quality. And so for those of you who haven't been Zooming over the last month, and my guess is most of you have now figured out Zoom, you might know that down in the bottom section of your window, there is an area through which you can type chats. We've received them from everyone from Scott Lewis to Ryan Sinanen and Frank Berger. So appreciate everyone sending us notes in the chat area. Well, those will be monitored by some of the GPN team for relevant questions that will come in during the course of today's session. And Lorie and I will do our best job to answer those. Again, that's just a bit of housekeeping. And so everyone, again, knows we'll have you in listen-only mode today, and your communication with us will be limited to the chat window. With that, I think we're going to go ahead and get started. This webinar series from GPN Technologies is called Next Steps, and it's a weekly practical roadmap to getting back to business. This is the first in a number of sessions that are going to come in the next 2 weeks, and this session is called Preparing for Tomorrow. We hope to provide you a set of action plan items that every ECP business owner should be thinking about today. There'll be practical insights on dealing with the new way that your practice is going to be thinking about delivering care in the coming weeks and months. I'm thrilled to be the moderator. My name is Scott Jentz. I'm a doctor of optometry with over 25 years of clinical practice experience and ownership. And I spent a lot of time in my career as a state and national optometry volunteer, and then was the founder and former CEO of a cloud-based software company from which I retired in 2018. I serve as a senior executive coach to GPN Technologies as part of my executive business coaching service called Sandbox. And I will be the moderator of these next step sessions, and I'm thrilled to have those of you who have joined us along for the ride. It's my pleasure to introduce today's featured expert, Dr. Lauren Lippiatt from Ohio. She's president of Salem Eye Care Center that she founded in 1989 and is one of the most progressive ECP business owners and clinicians I've ever met. She has the distinguished ability to have led in our industry, both in the optometry software and technology sector, but also served as a consultant for companies ranging from Vision Web to OfficeMate, Eyefinity, and Marco, and is currently on the executive board of the Optical Women's Association, which happens to be our sponsor today for this session. Thank you, Dr. Lippiatt, for joining us today and sharing your time and expertise with us.
Thanks for the kind words, Scott. It's a joy to be here.
All right, well, it's great to have us together, and let's try to keep this entertaining. Our goal today in this first session is to provide early and actionable checklist items that every ECP business owner should think about addressing in the next 2 weeks. I want to caution that we don't pretend for this to be some sort of legal guideline for HR or some sort of specific operational manual, but instead, it's the goal of GPN Technologies to provide you this first overview so you can think about the things that a practitioner like Lorie has been doing now in over a month of serving emergency patients actively in her clinic. And we will be getting more in depth on a series of other topics in the Next Steps webinar grouping, as you've probably seen through when you registered for this session. And we hope you'll join us for all of those. We're going to cover 4 areas of regard today. First, we want to think about a clean and healthy and safe environment for patients. Second, we want to think about staffing, both apportioning your staff today and in early days of reopening. We want to talk a little bit about leadership mindset and your preparedness for your leadership. And we also want to start to dig in a little bit on patient schedule. So Lorie is in her practice in Ohio, and our first area is this clean, healthy, safe environment for patients. And I'm going to turn it over to Dr. Lippiatt, who has got herself logged in on her iPad Pro, who's going to walk through the practice that she's been seeing patients in so you have a chance to see it yourself. Take it away, Lorie.
Hi, everybody. Hello from Ohio, where we actually did get some snow last night. So it was nice to see those wonderful temperatures. I'm currently standing in the entryway of my practice. We have remained open for emergency care only. And today, as Scott said, what we want to do is just plant the seeds for some of the things that I've had to go through and work out. And if I can shorten your curve, that would be my pleasure to do. We started with a 14-day shelter in place or stay at home, which quickly turned into another 4 weeks. So we're entering week 5, something that we never thought would happen. When we first had the 14-day shelter in, we did get a letter from the state board saying, you know, for those of you that can, we would like you to stay open for emergency care. I'm in a small town. I'm in Rotary. I have fellowship with all of the area doctors, and they were telling me the same thing. Lorie, if you can keep these people out of the ER, that would be great. And I'm thinking, okay, we can do that, but how do I do that? How do I make my practice safe for my staff and my patients? And today, that's what I'd like to spend this virtual tour talking about. So the city health department, when we were classified as an essential business, said, hey, if you're an essential business, you need to post your new temporary hours, and you need to have a limit on how many people can be in your establishment at one time. There were no real clear guidelines for that. I met with my team, and we'll talk a little bit more about meeting with the team, but we sort of, based on our size and our space, came up with the idea that we felt comfortable with no more than 10 patients, and we didn't anticipate more than 10 because we were going to emergency care only, but we did need to post that. So I'm going to walk outside briefly. It's going to get loud for a minute. I am on the main street, and then I'll come back in. I just want you to see that we didn't get fancy at all. We just simply posted our new hours of operation along with our building capacity. You'll also notice that we started to take note of every single surface, and we're going to spend some time talking about surfaces today, but starting with your outdoor entryway, you need to start thinking about patient surfaces. As I started thinking about how I can make the practice safe for both staff and patients, it seemed to me an obvious thing was to install some type of hand sanitization station right as the patient walks in. We chose this station. We actually have always had this, but we moved it closer to the entryway from Cintas. And it is an automatic dispenser, so a patient doesn't actually have to touch it. You just wave your hand under the unit. And that is 70% alcohol. Next, we immediately decided that it would be safest for us if we asked patients to enter our building with protective covering. So we're not only asking that on the phone as patients call in, but we're reminding them right at the entryway. You'll probably notice that we have a lot of railing. So the next step was to figure out how we manage surfaces. The way we're currently managing all these surfaces that would come into potential touch zones for patients is we are disinfecting them prior to first thing in the morning and after every patient enters and exits the building. If no patient is in the building for an hour, we're going to once an hour, all hands on disinfection of all surfaces in the building. So the waiting room, we have two different areas for patients to wait to be taken back to the clinic or the optical. Thankfully, we do have space, so we were able to carefully place the spacing at a minimum of 6 feet apart in this front area. We have also locked down any frames that are on display so that we can always maintain control of what a patient is handling or not. So here you're going to see spacing that is quite adequate in our front area, far apart.
Lorie, is that different than what you had before? Could you
Oh my
comment to
gosh,
the
yeah.
attendees?
Yeah, great question, Scott. Yeah, it's about half.
Thank you.
So some big changes. The next consideration was I have a pediatric optometrist that works here on the lower level. We knew that we needed to manage space, so it was a hard decision, but we actually had to close down the lower level of our building so that we could safely take care of our patients and manage disinfection. Everybody's been to the grocery store, to Home Depot, so it's no big surprise as you walk towards the front window to see the spatial spacing markings. Everyone in our town, at least, is very familiar with this, so this is nothing new. Since we're only seeing emergency patients, we didn't anticipate a problem, but we wanted to get in the habit, and that's something I want to mention. I can tell you I'm a very process-driven person, very process-driven. And had there been a template for all of this, it would have been so much easier, but there wasn't. So I want to say that this is still a work in progress. My decisions today may not be my decisions next week based on staff and patient feedback, but I think we're off to a pretty good start. At the front window, this is something new. We have installed these breast shields. This is glass that we installed, plexiglass that we installed with these aluminum brackets, go all the way up and have an opening at the bottom. So here is the opening, and I'll show you how we decided what size to make that opening. So these are mounted into the wall with screws, and then the plexiglass was drilled and then fastened with fasteners to attach. We had this custom fit at our local hardware store based on our window size. We've also asked patients to respect social distancing in a number of areas throughout the clinic, as well as in our inner sub-waiting area. Again, changed the spacing and prominently displayed the letter that we sent out to all of our patients regarding all of the safety measures that we're taking at the clinic. So moving over to near the optical area, we have closed down our second window of entry for patients, although we have installed the same plexiglass shield that again extends.
Lorie, there's a question along the way I'm just going to throw in as you go to your next step of presentation and move away from the front desk area here. If somebody doesn't have the opportunity to have a check-in window, they might be asking and have asked, what about, do you also use masks? Do you think masks alone are sufficient? Could you comment on that as you walk to your next area?
Oh, absolutely. And if you hold on for just a minute, I'll even show you what's at every staff member's workstation. But we're, and Scott and I will get into this, we're actually in full PPE during any type of clinic hours, and we'll describe what that is. The plexiglass shields are just an additional barrier. And I will tell you that it has made such a difference with staff, which is something that we'll get into as well. But it's not the only barrier. So we'll talk about other barriers. Preparing the optical, there needed to be some big changes made here. The spacing, we were able to manage. As you know, we are only seeing emergencies. So our optical, sadly, has been sitting empty, but we're working towards when we will be resuming normal operations. So we're preparing now. We're trying to get all this spacing and all of these things thought out before it actually happens. We've decided to take a more concierge approach, and we've kind of always done that to some extent, We will be bringing frames to the patient. We have sanitizer at every unit, and we will be asking the patients, while the opticians are wearing gloves, to put the frames on, and then we will be collecting them in a unit that will then be used frames or tried on frames. Those frames will then be sanitized.
Lorie, as you're speaking, a question had come in about the locking down of frames from patients just wandering and touching them. That'll be a combination of signage and then the verbal advice of your staff to, if you will, police that. Is that how you're taking care of that?
That's correct. Although for those of you that have these type of units, you can get a lock for the frames. So you might want to consider doing that if you want the ultimate control.
Okay, thank you.
So I'm just going to briefly walk into the Opticians Station and show that this would be her normal headgear for the day. We have these shields that are mounted to spectacles. We all walk around with these in the office, as well as gloves and masks. So this would be normal attire for us, even during the period of time that we're just seeing emergency patients, with no exception. So everybody that's here right now has agreed to the protocol. So I'm walking over to the front desk area now. Some changes that we made. We always had the clipboard, you sign in. We are no longer doing that. We're simply marking the patient as arrived on the terminal, on the computer system. We have been practically paperless now for probably over 15 years. So we don't have charts or anything like that, but we do have a coronavirus intake form that we're asking patients to fill out. So we do have some paper. We are asking patients to use their own pens. If they do not have their own pen, we have pens that have been sanitized. And when they're used, we are putting them in the tray that needs to be sanitized. So a little bit of change there. Again, the face mask and the gloves and the shield.
Lorie, we're going to come back to this. I want you to finish your tour, and then we're going to come back to the question around lots of questions coming in about how you found your PPE and how you found those shields. Don't address those now, but as you get back to your chair, we'll talk about those. I know that's coming up.
I knew those would be questions, Scott, because I had the same problem. So I can't wait to help people out. Some other changes. We used to have magazines out in the reception area. You didn't see any of those. We used to have the daily newspaper delivered for everyone's reading pleasure about Salem, Ohio. That's all gone. Probably the most sadly missed is our candy bowl. The kids used to love to come to get their suckers and their Tootsie Rolls. So we sadly had to empty that out. And I just had the girls put that there so I would remember to mention that, because all of these things, I hope, as you in your mind are thinking about your own practice, you think, yeah, that's got to go, or I've got to change that around. So I want to walk back to one of the exam. We're working out of really just 2 out of the 3 exam rooms in the practice now. And I had to work out this workflow. We were having trouble with knowing whether or not, because we're working with limited staff, whether or not the room had been taken care of, whether the room had been properly disinfected or not. So we came up with a little workflow. When the staff member, the technician, walks in with the patient, we have this sign on the chair so the patient can see it. This room has been disinfected. Then the technician takes it and leaves it here, stating that it had been disinfected. And the protocol is when the doctor comes into the room, we are flipping it upside down, and it doesn't get returned to the chair until the room has been taken care of. So that saved us a lot of shouting back and forth, has this room been done? Has it not been done? Most of us have thought about the slit lamps. I know there were a lot of things online about the shields. That's been a real big plus because you saw our face shields, and I wear the face shield too with my glasses, but it doesn't work behind the slit lamp. So we have the plexiglass shield on the slit lamp that we're using. And then if I need to refract someone, again, we're just doing emergency care, but some post-ops and stuff I've had to refract. I have the Marco digital system, and I've been able to move the tower 6 feet away. So I'm sitting on my chair with my computer, and we've managed to social distance that properly. So I hope this gives everyone just a brief overview. There's so much more, but figuring all this out is half the battle. So Scott, I'm going to turn my iPad off and return over to my office and join you there.
All right, thanks for the tour. We're getting a lot of great questions, and again, we will collate them over the course of time. There'll be some that I'll be able to take during the course of the presentation, and there'll also be an opportunity for us to answer some at the end. And if we don't get to them all, because this is a series, we'll make our best effort to either post follow-ups through the website that GPN will hold for this content, or we'll address them in future sessions. Now, this section, before we move off this section, is about acknowledging fears. There's a real concern, and Lorie has addressed this with patients that, they aren't even leaving their house to go to the grocery store. And so these protections are part about making our staff feel good. We're going to cover staff in the next section, but also making sure that our customers, our patients see that we're taking care of them. That is very important. Lorie, I just want you to briefly talk about these realities, these concerns that people are experiencing as you've been delivering emergency-based eye care in the last 4+ weeks.
Well, the first thing I want to say about that is don't dismiss fear. Fear is very real. Fear is very real with your staff. And we're going to spend a little bit of time talking about that. The one thing I didn't mention about the office, Scott, that I do want to mention is that we have had a UV filter system placed in our furnace system, and that helps kill mold, spores, and viruses when you blow the blower 24/7, which we had to get in the habit of doing. But I just wanted to mention that because that little thing did a lot to help with my staff in terms of feeling safer. And I think that when we talk about fear and we talk about our staff, that surprisingly has been a bigger barrier for us than patients. We've actually had few problems with patients because our patients trust us. We're the local eye doctor. We had to do a lot of work with staff to help them overcome. And one of the biggest things that I found is the more you do to keep them safe, the less fear they have. So we had to, in the beginning, start from scratch. I mean, I've maybe heard the word PPE, but I didn't really know what it meant. So we had a lot of learning to do in a very short amount of time. And as we worked through that first and second week and got to understand it, I could just see the staff coming back down to better levels.
Great. So there were some questions around, we're still on patients for the moment. There were some questions around how you might be thinking about protecting the patients or protecting your staff from patients, right? One of the most common reasons to utilize masks is not necessarily to not bring in the virus, but to reduce the amount that goes out in case you're seeing an asymptomatic patient. Are you providing the equipment to your patients as well?
Certainly. So we have a 3-step process. The first step is at the patient confirmation stage. The patient is advised to wear a mask to our practice. In our town, that's not unusual. All the doctors are doing it. So anyone that's been to a doctor, a vet, a dentist, or anywhere has already been asked to do that. So it's not abnormal. We're reminding them if they have it in their pocket to put it on as they enter the front door. That's number 2. And number 3 is if they don't have one, we are providing one for the patient. If the patient is accompanied by anybody else, which we're discouraging, but if so, we're asking them to remain in their vehicle.
There's a handful of questions also around the reality that you're ahead of this with all the disinfectants you have, all the shields you have. Let's just briefly talk about the protective equipment for your staff, the face guards, the plastic guards, the masks that you do have. There are people that are concerned they haven't been able to access it. I don't know that on this session we can give them resources where they can find it. Obviously, hospitals and your frontline personnel are dealing with shortages themselves. Can you just speak to some of the availability, particularly of those clear plastic shields you have?
Yes, and if you are on this webinar, you will get all of that information in the download. So we've compiled all this for you guys. And that was one of the first things I did was get the protective gear. And if you haven't done that and you plan on starting back anytime soon, it's already late. So do it now. We have all the resources for this type of gear. These just fit on any glasses, and we are wearing masks under them. Now, we're wearing surgical masks. Dr. Abraham and I, when we start seeing patients on a regular basis, will be wearing the N95 masks. They will be here on Monday. So you can still get those. We put the resource from where you can get those, but I would say order them now so that you have them. For everyone else, they're wearing masks under the shield. So as Scott said, we want the patients wearing masks and we want to be wearing masks. What my main concern about is being as safe as we possibly can. To that end, Dr. Abraham and I, who always prided ourselves in wearing, sporty clothes to work, are now wearing the scrubs. So she informed me this morning, she was here seeing a few emergencies, that she's never going back. But I'll tell you what, from a safety and hygiene standpoint, not wearing street clothes to the office has been a blessing. All of us are, taking proper steps to ensure that we're removing things as we enter our homes and washing them. And it's just a better feel.
All right. I just want to make sure that we cover a question that's come up because I don't think we're going to come back to it. There are some other sessions that we'll be holding in the next step webinars about deeper cleaning in the practice, but lots of questions around the eyewear displays you had and cleaning frames. Now, one of the things that research has shown is that this particular form of coronavirus, SARS-CoV-2, has a lipid outer layer. It's an inclusive kind of virus. And so that lipid outer layer is highly sensitive to soap. In other words, like any sort of fatty material and oily material, if you go ahead and apply soap to it, you break it down. So I want to make sure everyone knows that simple soap and water disinfection, use those air quotes, is actually considered a standard. Now, there were questions, Lorie, about everything from Barbasol to rubbing alcohol and others. If you could just briefly hit that because it seemed like a really hot one, and then we're going to move on to some other topics. But please, if you could address that further.
Sure. So again, navigating these waters, I said earlier, there's no template. As Scott mentioned, the biggest thing above everything is hand washing, and we're doing a really good job with that. The frames. So we will be, and we're not now seeing regular care patients, we will be taking measures to ensure that our frames are handled safely and safely returned to the frame boards. Right now, our intention is hot, soapy water, drip dry, and replace on the boards. That's our standard at this time. That may or may not change by the time we start seeing patients again. The other thing I want to mention is the bathrooms. So we do know with this virus that there is a fecal oral route of transmission. We have, I didn't want to show you the bathroom, but we have put the Clorox protection in the tanks. We are using the Clorox wands. We're wiping down the bathrooms before and after patients enter or exit. We have separate staff facilities, but there is a sign in our bathroom to close the lid before flushing and wash hands. And I think that's important to mention.
So two other topics in this area. Are you washing your employees' scrubs? I guess not.
No.
Are you, so they're doing that and being asked to do, normal height. Are you re-gloving between patients?
Yes.
I would assume so. Are you remasking between patients?
Not at this time. We're wearing the mask under the shield.
Yeah.
There's a supply issue. That may change. I'm hoping all of this changes by the time we start seeing a normal patient schedule. To give you guys an idea, some mornings, we're only open from 9 until 12. So some mornings I might have 2 patients, some mornings I might have 4. I think the most important point to mention is that this has been a process that we have learned from, and Scott and I are going to talk about how we learned from that and how we manage as a team to get to where we're at today. But it is important to start engaging your staff early because everything feels different. It feels different to wear gloves adjusting a frame. It feels different to wear gloves doing BIO. So it's important to get some practice wearing all this stuff.
So the last thing that bridges between safety, particularly for the staff and patients, and discussions of staffing is telehealth. There's been a lot of content that's been pushed out to ECPs about telehealth, teleoptometry. You're using it in a very specific way. I just want to give that a few moments of consideration, if you wouldn't mind, before we move on to staffing matters.
Yeah, and you know what? There's so many good articles and webinars, and I've attended many of them too, the billing and coding and all of that. We only installed telehealth last week. We got it all set up in one day. We are managing telehealth as a means for triage mostly in our practice. It has a limited indication just from what we can actually do with it. But what we have found is that patients are wondering whether we have it or not. So they're hearing video conferencing or telehealth from their other practitioners. So we sent out our email blast. Our email blast actually goes out today, and our Facebook announcement hit yesterday, I believe.
Okay, great. So triage, patient questions, because of familiarity in other healthcare settings, not necessarily at this point being used to diagnose anterior segment diseases and others. I can verify from another ECP that I talked to in a high volume practice this morning that the kinds of conditions they're seeing, from scleritis to iritis to corneal ulcers, to try to keep patients out of emergency rooms, and it's not necessarily, although it can be, it's not necessarily being used by the small sample that I've spoken to for patient care itself, but more for communication. So that's great. We're going to shift gears to the discussion of apportioning staff. Now, you have been open for over 4 weeks, so let's talk briefly about what you've done to try to get your staff connected, to reduce their fear as you spoke, and let's try to give folks some ideas around how they're going to contemplate staffing for whatever soft opening they choose to do.
So guys, none of this is easy. It's hard. The first thing that I needed to do was determine who my staff really was. So we range from everything from people that were freaked out and wanted to run out of the building to people that said, we're here till the end. Okay, that's great, but what does that mean as an employer, as a business owner? How do I take care of them? So we really utilized a lot of resources. One was the Ohio Department of Health put out COVID-19 information for business and employers screening employees for COVID-19 guide. So we go by that. We are monitoring temperatures every day. We are assessing each other every day. We are ensuring our own health first. So I just want to be clear that we do have a protocol for who is at work and who is not. Next was determining who I really needed here for the emergency period. Obviously, there's not a lot going on. I underestimated, though, what's actually going on, and we'll talk about that, and that's the telephone. But what I deemed as necessary to manage what I needed to manage was one optician, one person that could man the front desk and also be cross-trained in pre-testing. And then I needed me, or Dr. Abraham, and then I needed a back-end biller. So that's sort of what I started with. Since that time, I've added more phone support. what I found is our phone rings nonstop from about 8:30 in the morning until 1 or 2, and then it goes dead silent. I can't figure what what everyone's doing at home in the afternoons, but they're not calling us. So we kind of figured that out, and we're using that phone support more now and now, more and more. So we identified the core team, and then that meant there's other people, right? So we did furlough 3 people.
And so cross-training matters. You're trying to deal with the base needs of the clinic. Let's talk about working from home. There's some businesses that can do that a lot. You're probably utilizing some at-home employees, particularly with the phones or other things. What are you doing there?
Really, the back end biller. So she has a VPN set up at home. She can log in. She's been working, you read all the stuff. Everyone's working on past due. Everyone's working on cleaning things out, all the normal stuff. But she has been able to work from home remotely. Starting next week, she will be back here because we do need more support here as we start trying to gear up to manage regular patient care next month.
Okay. And the working from home piece, just as a basic summary, has worked fine?
It has.
Okay. Now, there's a few questions around taking care of the staff, right? They're putting on their scrubs at home. They're washing them at home like you are. You're taking their temperatures every day as a precautionary measure. Are you kind of getting, one person got, I think, appropriately into the weeds, right? There's been a conversation around the shoe tracking ability, particularly of bacteria, but of viruses as well. Are you controlling footwear in any way?
Everyone's Lysoling their shoes with we have a Lysol can or thingy at the door, so they're doing that when they enter and then when they exit. You're right, Scott, and actually recently, as recent as this week, I looked at the little blue booty things that you put over feet. So again, as I stated during the tour, this is a work in process. We may be adding, we may be changing things. What I can show you is what we're doing today, but I think that's a very, very, very valid point.
Okay. Well, the staff realities that you've dealt with are helpful, and I think that the takeaways for me and hearing you speak are that the attendees should be thinking about kind of the minimally viable personnel, the realities of some folks being on extended furlough. We are going to be providing, perhaps, I think, in our resource center, sort of a general template furlough letter. That's something that everyone should be thinking about cautiously from a HR and a legal perspective as you send people off into extended stays from work. But that's a good summary of staff. I want to get into area 3 of the session now, and that's around leadership preparedness. You've talked about communication and such. And I'm going to show a resource or two that we'll send a link out for in a moment. But why don't you speak a little bit about just, how you've had to think about yourself as a leader at this time?
Right. So I'm going to start with this, I think, appropriate quote from Woodrow Wilson that says, "You are not here merely to make a living. You're here in order to enable the world to live more amply with greater vision, with a finer spirit of hope and achievement. You're here to enrich the world, and you impoverish yourself if you forget the errand." So what I've learned mostly is more about me. Your staff needs you. They need you now more than they've ever needed you. And they need you to be a leader. And whatever that means to you, you need to do it. For me, it was remaining calm and knowledgeable. It was talking about the webinars that I was listening to, educating them about AOA communications, state board communications, safety recommendations, all of the things that you're probably doing. You need to let the staff know that you're doing those things. They need to understand that you're the expert in your practice, and you are that person. So communicate everything that you're doing with them. The other thing was be present. By be present, I mean, I only saw patients Monday, Tuesday, Wednesday before all this. And Now I understand I need to be here Thursday and I need to be here Friday. I need to be a support for them. I need to be here to answer questions. I need to be here to understand what patients are calling in asking about and helping them work through this. So I need to be present. I need to have a plan. So having a plan is really, really important. This isn't the time to be shooting from the hip. If you plan to open, let's just pick a date, June 1st, whatever that date is. You can't come in May 31st and expect for all this to slide into place. This is a process, and it's taken me quite a bit of time to get staff comfortable. It's a whole new way of doing things. Everything feels different with gloves. Everything works a little bit different. So you need a little bit of gap time there. And be aware that your plan is going to change. And those are things I don't like. I like everything to be the same and perfect. Well, this isn't perfect and it's not the same. My plan today is way different than my plan was when all this started. Communicate regularly, frequently, and humbly with empathy, and extend a little bit of grace. Your staff's going through crap too, and it's not just about you. So be aware of that, and then practice what you preach. I mean, if you're asking your staff and your patients to wear a mask through the office, you better have a mask on. So, you know, it is a great opportunity to step up as a great leader for your staff.
You know, there's a wonderful book written by an author by the name of Patrick Lencioni. It's called The Advantage, and it's written in around the concept of organizational health, and an eye care business is an organization like any other. And it speaks to this idea of creating a plan, creating a communication plan, and then communicating to the point of risking what you might perceive as over communicating, because the reality is that too many times you have to say it three different ways and 3 times in order for anybody to hear it. This article that I've got on the screen briefly for a moment, and then we'll take the screen share away, is going to be something we'll send you a link to. It's already a couple weeks old, but it's from Gallup. And Gallup did an interview of employees and businesses and found that leaders have to take the time right now to really get thoughtful about how they do it. And we're all different. Some of us are very extroverted. Some are very introverted. To the Lorie's point, some of us just show up at clinic and see our patients and go home. Some, you know, sort of put the strength of and empowerment onto our staff to run things. Now it's time for us all to step up. And the 4 points in this that I want to highlight is that at the time of this poll, only 39% of the respondents had a strong agreement that their employer had communicated a clear plan of action. And only 54% were strongly sure that they felt clear about what they were prepared or to be doing in their job, that they were well prepared. And this idea that the supervisor, or in our case as eye care business owners, are the supervisors, that we have a clear understanding about what's going on in the organization, whether it's applications for the payroll protection plan or anything else that we're doing around PPE and, you know, disinfections. The more communication, the better. That will result in a feeling by an employee of well-being and of being treated in a way that makes them safe and makes them willing and interested to take care of the patients, as we've spoken about today. So we have these links available. I am going to take the share off now and get back to our Q&A and our presentation. So Lorie, I want to step to the next section for a moment. And I just need to arrange my window to see a note for a moment. We're going to talk about scheduling, and we're going to finish the topic today with scheduling. And we're grateful that everyone's already been on for 45 minutes. I hope you'll stick with us. We're going to cover scheduling today, and it's also going to be our presentation next Tuesday in a much more deep way, and at a time where you'll still be able to take action. We need to start priming the pump of thinking around patient scheduling. Lorie, now for these 4 weeks, can you give us an overview of the things you had to do that might be, you know, nice ways to set a foundation for what we're going to talk about next, which is what should we do in the coming weeks? But what have you done with your schedule to see these emergency patients?
Right. So I think those are great questions, Scott. And to his point, we're going to spend a lot of time next week going into detail about different approaches, if you will. Our approach the first 2 weeks was first to figure out how to save our own ship. You know, put the oxygen mask on first. So get the staff secure, understand where we were as a team, and then decide, you know, what type of emergency care we were going to provide, and then move forward. As we did that, the first thing we did was communicate safety measures to our patients. We did that through an email blast and also our social media, and Facebook and Instagram are what we mostly use. Then we needed to develop a whole new protocol for the emergency services, and in terms of how we're going to disinfect, how we're going to sanitize, etc. We needed to make changes to our website. So I'm sure everyone's probably done this, but if you haven't, make sure your website's up to date. Patients are going there, whether you realize it or not. We also have a chat, like an Insta chat on our website. So we had to make sure that was connected to the new hours, just little things you don't think about. And then what started happening to us is we allow online scheduling. So we were finding that patients were scheduling online for times that we weren't even here. So we had to learn that fast and block all those off. And then understanding our automated recall, like when do those start going out for how far in advance do the reminders go? We pre-appoint, so it's like 3 weeks out. So patients, when this all happened, my last day was March 18th for regular care. We're talking about this time, they were sending confirmations out for patients and we weren't going to be open. So we had to deal with that. And this is, again, very high level, but I want you to start thinking ahead. And then finally, what is our new schedule going to look like? By new, I mean the new tomorrow. We have how we used to practice, where we are today, which is very limited practice, and then the stepping stone to back to maybe normal someday. So what does that look like for you? And we need to start addressing the schedule now, because we have all the patients from March and then all the patients from April that we need to do something with, and then the patients that are already on for May and June. So Scott, to your point, we need a whole session to talk about different approaches and the staging of that. But if we can at least get an idea of where we need to go, that's half the battle. And then probably another important key element is you might want to really just work with a couple of your key people on this. Rather, in our office, anyone could make an appointment, anyone could schedule, but I found by tightening that down so that I have 1 or 2 people that are managing that schedule right now, that's been really, really helpful as well.
Well, we all realize, I'm getting text messages during this session about various states coming out with updated guidance on what May will look like in terms of safer at home controls versus not. We all recognize that New York City compared to Ohio, Columbus, Ohio compared to Madison, Wisconsin, and Billings, Montana are different. But when you think about May, right, we're here just past the middle of April. Have you already begun to change the way your automated recall system is working? Give everyone a snippet of how you've adjusted communications for May appointments that were on the books.
Great question. And, I had to give this a lot of thought. We decided to manhandle the schedule for May, all of May. We stopped everything off for any type of recall because we don't know. I wish I had that crystal ball, and it's going to be different for everyone. I wish this could just have a date that it all went away, but it's not going away. So everyone is going to have to decide for themselves based on their practice, their patients, their demographics, when that time is, and the governance, from your state board or governor or local authorities. No one can answer that, but I guess the purpose of today is that is going to happen sometime. So these are the things that have to take place before that happens. And if there's one thing I can leave you with on that vein, it's staff. I cannot overstate how important it is to be working with your staff. You need them and they need you at this time.
So did you cancel your May appointments that were on the books and notify those patients that they would not be having exams, or have you waited to do that?
So our approach is this. When we return, we're hoping we will be able to manage a patient every 30 minutes with one doctor only in the building at a time. That's our hope. We don't know if that's going to happen. Early May, we're taking a very conservative approach. We are hoping that later in the month, we'll be able to manage that schedule, but I can tell you those are patients that were already on. So what we did was we took March and April and moved them into later in the summer. And what I do know is it's easier to take a patient off the schedule than it is to put one on. So we are literally taking this week by week.
So next week we can get in a little more depth on thinking about what kind of square footage you have, the number of employees you need, and what kind of a load of humans you can actually have in your facility to think about setting the next schedule. But at this time, you have made adjustments to these May and June appointments to start pushing them out until you get more time. And you've actually gone into your practice management software and into your communication system and been modifying things. Is that right? You have a couple of staff that are assigned to do that, and they are starting that work or have started that work already?
Oh, we've been managing the schedule since day one. So,
Okay.
that's something that needs to be done. And, again, stopping patients from being able to schedule online when it's not feasible for them to be in was critical for us. We would have been just making so many extra calls.
And you also use that communication system to give the patients the heads up on what to expect when they come in the clinic, to bring their mask. Are you checking your patients' temperatures?
Right now, we're not using any automation for this month.
Just email.
Yeah, no, we're calling. I mean,
you're calling. Okay.
Yeah,
Got it.
We're really manhandling things right now under the circumstances, and our patients appreciate it. They love the fact that we are communicating with them, and they know what to expect.
And they've been very understanding, I assume.
Entirely, and grateful. So the emergency patients that I've seen have thanked me 1,000 times. I had one lady cry. Just anything that you can imagine, from a mail carrier that broke her glasses to a truck driver to a corneal ulcer to ingrown eyelashes to, I can go on, but those people are so, you know what they're grateful for? They're grateful for the fact that they didn't have to go to the emergency room.
Yeah. So I have had some GPN team folks checking out some questions. We're going to try to hit a few of those. We are going to have to put some of these into an FAQ. You'll get some notification about how to do that. There was questions around the shoe sanitizing. You covered that. You said Lysol. You said the staff's doing their scrubs. Are there UV filters available? Two things were asked, I saw. One was for in the building, you have this UV filter in your system.
In our permit system.
That's built in, is that right?
Well, it was installed when we, yeah. So
but it's not a freestanding system.
No. That would be through your heating and cooling company. And it takes a UV bulb. Those have to be replaced on a regular schedule. So if you have one and you haven't had it replaced, you want to check into that, which is one of the first things that I did. But again, if you have that, you do need to leave the air circulating the whole time, they told me.
Are there any UV systems that you're aware of to clean either equipment like frames or anything else? I am not aware of any. I actually don't know the susceptibility of the virus to UV light necessarily, but do you know of any? Otherwise, we'll have to research that and answer it to those who have asked later.
I believe there is. I, in my earlier days, was a dental hygienist, and I know that there are UV wands that can be used to do chairs and other different things. So definitely something to look into. I'm not, again, with all this stuff, it comes down to availability. It's just tough to get some of this stuff.
And right now you're not providing, additional level services like OCTs and fields and things.
Oh, no.
So we're not going to worry today about those kind of pieces of equipment, although, again, 70% or higher alcohol content, folks, is effective against this virus. It's effective against most viruses, both common cold viruses and influenza as well. So I would generally advise that. you are talking about emergency care, and I've seen some comments about where is that line, and right, because I mean, somebody who's got a serious visual ailment has got a real problem navigating in life. You have really dealt with the acute care kind of cases and not refractive based exams, or are you from time to time, given your exam setup with your distancing setup and refracting equipment, able to deliver an occasional, more comprehensive exam experience for somebody who must have it?
Case by case on an emergency basis only. Again, I had a military police guy that busted his glasses and he needed them to perform his job. I had a mentally handicapped girl that was +8, -450 SIL, who busted her glasses in half and was having behavioral problems because, and she's stuck at home. There's no workshop to go to anymore. Her mom begged me to, help. So, I guess as a doctor and I've always said, I'm an independent doctor of optometry, and this is where your independence shines, when you can make those decisions on, helping people, because after all, that is what we're here for. And I know we're out of time, Scott. I just wanted, last thing I have to say, when all this started, I had to go back and reread our optometric oath, and I'm not going to read it, but I just want to remind you of two things, and that is that we freely and solemnly pledge that I affirm that the health of my patient will be my first consideration, and then the part about I will do my utmost to serve my community, my country, and humankind as a citizen, as well as an optometrist. And again, in parting, I hope that any help that we were able to provide, or just get you to start thinking that you can't come in the day before and make it happen, then I would consider this success.
That's wonderful. I just want to mention that I got a couple of well-intended comments from folks about UV, that it takes a while. There are devices out there. It doesn't disinfect immediately, and that some folks are looking at using it, but there may be some usability matters that you have to think about. We appreciate everyone understanding we can't answer all the questions. I'm going to conclude this by saying that we're grateful for you being here, but I want you to know something. I talked to an ECP today, a good friend of mine who has just recovered from COVID-19. He did every precaution he could in his practice in early March in one of the country's hotspots to take care of himself and his staff, and nonetheless spent 20 days alone in his bedroom, hoping that he would get through this, and he has. But to listen to the brutality of how this thing affected him, very healthy man who's really a go-getter, is sincere, was a sincere reminder of how important it is that you take the necessary precautions and understand that those that are on the front lines can be added to by optometry care that also can be frontline, but do it in a thoughtful and careful way. Listen to your national CDC guidelines, listen to your state guidelines, profess expertise where you can, and seek answers elsewhere. We're thrilled that you've listened to this first step of GPN's webinar series. The next one will be a much deeper conversation around scheduling for safety and success next week, Tuesday, the 21st of April, same time, same channel. It'll be the same two of us, me and Dr. Lippiatt, and we're really grateful. You are going to be sent a link or a download by email of the document we promised you, including links and other information. And we're hopeful that will spawn more conversation. At GPN, we're about trying to share information so you can make real educated, guided decisions about how to do what you're going to do in your community. We're grateful for all the ECPs that care about this enough to have attended, and hope that you'll join us for the next one. With that, I'll say I'm Scott Jentz on behalf of Dr. Lorie Lippiatt and the GPN team. Thank you for attending. We hope you'll listen to the rest of our sessions. And with that, we bid you a great day. Continue to be great at everything you do, and be cautious out there.